So maybe a first question would be, give us a state of just your tribes. Madison has just been designated in December, Truax Field, as the home of F35A. Doctor, can you start? Give us an overview. WisconsinEye, in an attempt to bring you the latest information possible on the health emergency, is interviewing those on the front lines of this emergency. We all go to the grocery store. So it's a very appropriate time to interview Brandon Scholz, president of the Wisconsin Grocers Association. Brandon, thanks very much for joining us.
Steve, thanks for having me on, and thanks for all you guys do at WisconsinEye. It's fantastic.
Thank you very much. Give us an overview of the grocery industry in Wisconsin. How much business does it do, and number of employees, Brandon?
You bet. It's about a $6 billion business because every community's got at least a grocery store, if not several more. Probably 80,000 employees throughout the state, from your smallest grocery store that might have 25 or 30 people to some of the largest chains in the state that have thousands, 13, 14, 15,000 employees. And that's just at the retail level. Remember, there are warehouses that have hundreds of employees. There are trucking operations, there's suppliers, there's manufacturers, there's vendors. There's the folks that deliver soda and beer and water to your store, along with potato chips and potatoes. So it's a vast supply chain, really, to get the products to the store so that when you go shopping, it's there for your convenience to put in your cart and to check out. But to get it there, it's a long path to make sure it happens, from our dairy farmers and other manufacturers to the cattlemen, the stockyards. This is a big, big, big operation.
Well, Brandon, I'm just struck at the number of changes in the grocery industry over the last month. I'm going to list a few and then you elaborate. I mean, plexiglass now separating the shopper and the checkout person, limiting the number of people in stores, senior hours, online ordering, pickup. Okay, I'm done. Give us an overview of these and other major changes in the grocery industry, and not just in Wisconsin, but nationally.
Sure, and let me tag on to the last one you meant, and that is online ordering. That's gone from about 3% of the business to about 30% of the business. It used to be that you could order online and go pick it up that day or whenever you wanted, or have it delivered to your home when you wanted. There's now several days, there's a wait time just so that the store could get your order, pick it, and have it ready for you to pick up, because there are so many orders that have come in, and they've had to bring on more people to do that work. It's not just something that somebody who's maybe bagging your groceries will go out and pick the order. So they've had to add more people to that. But there have been lots of changes that have come into the stores that the shoppers might recognize, or they might not. Let's start with the basic one, and that's sanitation and disinfecting.
Please.
When the governor announced his emergency health order, a lot of changes came real quickly to the stores. And I want to come back to the biggest change, and that was the stockpiling and the hoarding. But what came to the stores in the very beginning was to shut down all of those areas in the store that customers would touch. So salad bars, hot bars, coffee grinder machines, water dispensing machines, vending machines that you touch a button. Anything you touch a button to was shut down. The only thing that was left in place was the deli and the meat counter and the produce section. And most stores have kept their delis open. Some have gone to just already putting products in containers and having them there where customers could pick them up. Meat department, same thing. Some have just essentially wrapped all their meat and put them on the counter. Others have kept part of that meat and seafood department open. And in produce, you see a mix of items that are pre-bagged now or pre-wrapped before they come on the shelves. For those that aren't, we advise customers to wash those products with either a vinegar and water solution, or for rind type products with water and bleach. You can't be more than safe here. You have to do it. The stores themselves have been, on a high level of, let's clean this place, let's sanitize it, let's make it safe for our customers. But this isn't new. Grocery stores are regulated by most agencies in the federal government, most agencies in state government, and a lot of agencies at the local level. So cleaning the store, sanitizing the store, and disinfecting the store is not something that we just learned last month when this all started. This has been going on for years and decades, and customer safety is the highest priority. Most people are afraid of foodborne illness, which is completely different than the coronavirus. So it's a new challenge, but it's not a new thing to learn. So there's extra efforts to sanitize carts. There's extra efforts to sanitize handles in the frozen food department on the doors. Anywhere and anything that a customer will go in the store, they're looking to clean. Grocers have bought equipment so that when they close the store at night, they can sanitize the store in big areas. They buy these big clean clothes. Yeah.
Can I ask you a question just about that? Some stores that used to be open 24/7 have now closed and reopened like at 6 or something. Just give us a basic outline. How are those stores that used to be open 24/7? What happens now when they're closed, let's say from 11 to 5:30 or 6, to sanitize them? Just
Sure.
give us the short version of the basic outline.
Well, there's 3 reasons why stores are closing a little early, like at 7 or 8 o'clock at night, and then reopening at 7, 8 o'clock in the morning. 3 reasons. One is to sanitize. So you have the store where you don't have customers. You can move your machines around. You can move your people around. You can get that store pretty well sanitized from front to back, end to end.
Okay.
Reason number 2, it's a good time to stock the store. So grocery stores have trucks coming every day, sometimes 2 a day. Sometimes they have their companies come in and load the shelves themselves. So that is an opportune time to restock the store. The third reason is give your employees a little bit of a break. These folks have been working on a high level of, they've been working incredibly hard, and this gives them an opportunity to take a little bit of a break, go home, be with their families before they come back to the store the next day. So those 3 things are really the main reasons why.
Thank you. There's a graphic that you have on the WGA site that I want to show now, and it just says basically, starkly, fact: there is enough food, and the bullet points are any empty shelves are the result of increased demand. Please do not stockpile. We are working around the clock, but the anchor statement: our food supply is strong. There is no shortage of product. Why is the industry making that central point? There is no shortage of food.
Because you do see some shelves that are empty or have low inventory, and there's some things that people just from the very beginning stocked up on. One woman was found to have 275 rolls of toilet paper in her cart, probably a little bit more than what she might need, but you saw a big drain on cleaning supplies, on rice, and in some cases, these products are harder to get to market. For example, rice production is a long time. It takes a while, and some of it's overseas, so that's a problem. But we've seen shortages on some items that people went to. Eggs, some in the meat department, as I mentioned, rice, cleaning fluids, obviously disinfectants, toilet paper. So those sorts of things have taken a while for manufacturers to get on board and to bring back into the stores. But people should know, we have some of the best and safest food in the world because of our supply chain that's out there, from the growers and the farmers and the dairy farmers, all the way through manufacturing to retail. We are heavily regulated, and this food is checked to make sure it's safe. So that's number 1. There's plenty of it, even though you see some shortages. If you may have to buy something different. You may have to buy a brand that you don't particularly, that you haven't bought before. But for the most part, with the exception of a few items, the stores are stocked. There's food on the shelves. It may change your habits a little bit, but this is a great opportunity for people to think about what they want to have for dinner and what they want to have for lunch. This is no longer going to the store every day and saying, well, I don't know what I want tonight, but let me walk through the store and see what they have. This is an opportunity to sit down and say, all right, I've got a plan for 7 dinners, 7 lunches, and 7 breakfasts for my family. What do I need? And so it's a great opportunity to do a little meal planning, to think about nutrition, to think about your health, and go to the store.
As other industries and other businesses have been forced to lay off or furlough, has the grocery industry in Wisconsin picked up some of these laid off workers? Has there been addition? Well, you and I have seen the ads. Kroger, we're hiring. Walmart, we're hiring. Piggly Wiggly, we're hiring. Are we seeing some of these people laid off from the jobs they've had, becoming workers for our grocery stores, Brandon?
You bet, and that's across the state. As I mentioned before, you need people to fill out the orders for online shopping. You do need people to work in the stores to stock. For the last year and a half or 2 years, the grocery industry, as others, have struggled to hire people. We were screaming for workers. So we have the opportunity now, grocery stores across the state, to hire people who may have worked in restaurants as waiters or waitresses or whatever job they had, and in other industries where they're not considered essential and haven't been able to go to work. So we have the opportunity to bring those folks on temporarily until their businesses come back.
Does the federal stimulus package, the CARES, the 2.2 trillion with a T, does it do anything for the grocery industry, both nationally and in the state of Wisconsin?
In some cases, it does. If you're going to need a loan or the paycheck protection component of it, but the grocery business is up and running, and lots of the care package is for those who aren't. And so, in some cases, we will find some components of that will be applicable to the grocery business. Throughout all of this, grocers have picked up considerable expenditures and expenses for things that they've never had before. I mean, they've had to buy more cleaning and sanitation products than they've ever had before. You see all the stores now that have the sneeze guards, the plastic plexiglass that's been put up in front of the store.
Yes.
So you see those things that are going on, and they're going to do it. I mean, it's not a question. It's like, should we spend the money to do this? Well, yeah, spend the money to do it. Let's make sure our customers are safe. So it's safety first that drives what these guys do.
Okay. I want to ask you about two recent news developments, Brandon. Dr. Deborah Blix is a member of the White House coronavirus task force. And I was stunned yesterday getting ready for this interview when she said, this is not the week to go grocery shopping because of the fear of peaking in New York City and in Louisiana and in Detroit. So any of our viewers who heard that comment, that's not true in Wisconsin?
Well, a couple of things. One, Wisconsin looks to be scheduled to peak somewhere near the end of the month. But let's back up. What we've been saying since that very first week when people got the oh my God moment and they went to the store and they stocked up on everything and they hoarded, they overstocked. That has calmed down a little bit in the last few weeks because we believe people are thinking about what they need for a week rather than I'll go shopping for 2 days worth of stuff and then I'll come back. We have a public service announcement out there from Milwaukee Brewers coach Craig Counsell that says, buy what you need, put a plan together. When you need something else, go back to the store and get it. So our sense is that shoppers have done that. They have stocked up in their pantry to the extent that they need for a week. And then they will go back and replenish what they need. We're hopeful that that continues. But at some point when our government officials say this is a really critical week in Wisconsin, we hope that shoppers are prepared, that they have shopped and that they've got what they need to last them through a week. If they have to go to the store, they can, but be smart, wear a mask, get in the store. One of the things that we're also starting to push now is this idea of shop alone. This is not the time to bring your kids to the grocery store and have a family outing.
Yeah.
Go to the store, get what you need, get in your car and go home. There's no reason to go and kind of walk up and down the aisles and see what's on sale today. This is not the time for that. Get your basics, get what you need, and go home.
And I have to ask you about a sad headline in the Washington Post this morning, Brandon, which says that 4 grocery workers, now not in Wisconsin, they were in New York and in other urban areas, one of them in Chicago, have tested positive. How risky is it to work in a grocery store right now, nationally in the state of Wisconsin?
Well, the folks in grocery stores are on the front lines, and we know that the people that work in healthcare, doctors, nurses in the hospitals and clinics across Wisconsin and in the country Our law enforcement folks are, on the front lines every day, and so are the folks in the grocery store. Those checkers, those baggers, they have some of the closest contact and have had some of the closest contact with their customers since this all started. And again, it's why grocers are doing everything they can to keep their stores clean and sanitized, not only for the customers, but for their workforce as well. I guess it's almost miraculous that the numbers at this point are so low, and we hope and pray that we get past this without having folks in the store get sick.
What's the protocol in the Wisconsin Grocers Association for if one of their employees would test positive?
So we generally follow the OSHA guidelines as well as HIPAA guidelines. If somebody has symptoms, they go home. If they even feel like it, they go home. Because one of the things that one of the first stimulus packages said was, if somebody feels as though they have a COVID-19 related illness or symptom, they go home and you pay them. Okay, I mean, you're paid.
Right.
So in the event that somebody believes they have a symptom, they go home. If somebody has symptoms or the symptoms escalate, they're still at home. And if they escalate, then you're looking to see where they worked and what area of the store, so that you can check the employees that might have been near them to make sure that they are not symptomatic. And if there is, then they go home. I mean, that's just no question. There's no reason to say, stick around, let's see if it gets worse. There are people out there that can be hired to fill those positions temporarily while other folks go and make sure that they're feeling okay.
Do you have you heard a number of grocery workers in Wisconsin who have tested positive? We're very grateful that none of them have passed, like some have nationally, but how often has it happened that grocery workers in Wisconsin have tested positive?
Yeah, we hear reports around the state. Unfortunately, not very many, but we hear reports around the state that, this store had somebody that felt like they had the symptoms, and so they went home. Okay. So I don't have a hard number. It's mostly anecdotal when we talk to retailers and ask what's going on in their stores, how they're experiencing this, that somebody will say, yep, we had somebody in our store that they felt like they had a fever and they, had trouble breathing, so they went home.
And let's go back.
I don't have any reports of anybody hospitalized at this point.
Thank you. Let's go back to face protection. Do you think that everyone who enters a Wisconsin grocery store now should have some type of facial protection?
Steve, I'm not an expert in that field, so I think we rely on what health professionals tell us and tell people to protect yourself, whether it's a mask, whether it's gloves. There was a point when government officials and the FDA and CDC were saying that a mask doesn't protect you. A mask could be worn by those who may have symptoms. But they've changed that and said, if you have an opportunity to wear a mask, wear it. So, another issue is the industry is challenged in terms of finding supplies, whether they be rubber gloves or masks. And so the news that companies are manufacturing more is good news, because at some point it's hard to access those items. But when grocers can, when they find a source, they will, and they'll give them to their employees to wear.
Okay, let's go back to your graphic. There is enough food, because that's a strong message. But are you concerned 2-3 weeks from now there will be some shortages of these commodities?
No. As a matter of fact, up and down the supply line, the supply chain, from those that grow, those that produce, those that manufacture, they're all in that process. Nobody is slowing down. Now, you might see a company that might make 45 products decide to put all their time into making the 25 best sellers because the other 20 don't sell very fast. Sure. That way they can continue to put those things on the shelves. But there's nothing out there that says we're going to slow down the process. Okay. There are going to be some things that are tough to deliver. Eggs, eggs were in big demand. And part of the problem was packaging. Less so because the chickens weren't working, more so that they didn't have the packaging, because, again, a lot of eggs went into the restaurant business and into the institutional food business, not coming in little dozen cartons. So the industry had to change things up to make sure that they were able to deliver. Interestingly enough, while that was the problem with some of the large egg producers, local guys local farms in Wisconsin were readily supplying stores with eggs. So, it's a great opportunity for grocers to continue that commitment with their local suppliers as well. But there should be no shortage of product other than kind of what we've seen, some things in high demand. It's always going to be tough to make sure that cleaning solutions and disinfectants are there, just because manufacturers have had to ramp up from being completely wiped out to starting that process. So if you see something that's not on the shelves, yeah, there's a reason for it. It's not that it's never going to be there again. Some people say, well, I've gone back, every other day for a week and it's still not there. Well, there's just going to be some things that are going to be hard to get back to what used to be. But for the most part, grocery stores have an average of about 45,000 products called SKUs in the store. And, we might be short on a couple of hundred, but if you look around, you can find substitutions, you can find other things that you want to have on your table. And believe me, if there's something that is on the shelf, it's not because people aren't trying.
I wouldn't be much of an interviewer if I didn't ask you about the toilet paper shortage. Just real quickly.
It's interesting because coronavirus it's an inflammation issue. It's not an intestinal flu. So if you look at the symptoms and what people have, they're not having a lot of use for extra toilet paper.
Okay.
But in the very beginning, one health official said, you're going to have to stay at home. You need to go out and get toilet paper and water and the things that you need. Well, okay, toilet paper and water, really, you got plenty of water and you're not going to use more toilet paper than you have been using. So it created one of those, bizarre runs. It's like when it's going to snow, everybody goes out and buys bread. So the bread aisle is cleaned out.
Okay, understand. I just got a few more questions. Let's walk through again from the WGA website, your advice, your tips for shopping. Just real quickly. I'll read them and any PSs you want to add. Number 1, plan ahead. Number 2, go to the store with a list. Jump in here if you need to on any of them, Brendan. 3, bring your own disinfecting wipes. Now, when my wife went to the grocery store yesterday, they were out of them. We couldn't buy any more. So those are in short supply, at least temporarily. Number 4, try contactless shopping. As you said earlier, this is new for we Wisconsin shoppers.
Yeah.
And it's just exploded. You said up to 30%?
Yeah, for online shopping.
Right.
One of the things that we're also wanting to make a point of is that going to the grocery store is not a social thing. There are very few places that you can go these days where there are people.
Yeah.
But going to the grocery store is not one where you're going to socialize. Our advice is make your list, go and buy what you need, and go home. A lot of stores have had disinfecting wipes, at the front to wipe down the carts or in various places in the store. And they too are doing their best to be able to keep that in supply.
Okay.
You're going to see some stores start to go to one-way aisles so that everybody's going this way, then this way and this way, so they don't cross. Even in an 8-foot wide aisle, you're still not 6 feet apart. So you're going to see stores doing everything they can to keep people apart when they go there. But those 4 things that you mentioned: make a list, go to the store, go by yourself, shop, take your stuff home, and you're there. And if you need to go back in 2 or 3 days or a week, do so, but practice the same things.
Okay, back to those graphics. Number 5 on this graphic, tips for shopping: remember your neighbors, don't take it all. And number 6, respect the limits set on items. So those are just some basic tips that Wisconsin shoppers need to remember, correct?
Absolutely. One of the reasons why you see some things not on the shelves is because people did stockpile.
Yeah.
They bought 20 bags of rice. They didn't need to. That means your neighbor didn't get a bag of rice. And again, it's just common sense. I think we're past the point of overreacting now. I think people are thoughtful about what they're doing, but we don't know what the news is going to be tomorrow. And
Right.
so let's make sure that I think we're probably better prepared now than we ever have been for whatever news we're going to get in the next coming days or the next week. But again, we have a lot of food in this country. We have some of the safest food in this country. We have some of the strictest laws on the books that deal with food safety. So from a food safety perspective, if somebody finds some product that has a foodborne illness, that's off the shelves in a heartbeat.
Yeah. Just two final questions. I do want to respect your time. You and I have often talked, and you said groceries in Wisconsin, the industry has a 1% profit margin. 1%. Do you expect some of our Wisconsin groceries to not survive this health emergency, Brandon?
It's actually a little less than 1%. I think the greatest worry is for some of the smaller stores in the rural parts of the state. They have their own challenges from workforce. But again, the people that supply those stores supply stores around the state. So as long as they have the workforce, as long as their customers are coming to the store, as long as they can serve those customers, they'll survive.
Okay.
Some of them may not be at the level that other stores are in terms of online ordering and home delivery. So they will have to figure out how to make that happen. This is a very competitive business. It's not just grocery stores that want to be grocers. You have our friends in the convenience store business that are doing their part. You have other businesses like pharmacies that are selling food, and in some cases fresh food. We hope that our friends in the restaurant business are able to keep their businesses open through carry out and pickups, so that when we're past this, that those businesses can come back and flourish. So we hope that no grocers across the state ever get to the point where they just can't keep the doors open. I guess it depends on how long this is going to go.
Okay, and that really leads to my final question. What do you think Wisconsin grocery shopping will be like a year from now, assuming we're back to some degree of normal, my friend?
I think one of the changes that has happened that will hold will be online ordering and pickup and delivery. Okay. We're asking the governor right now to let grocers and restaurants be able to deliver beer and wine or spirits with the food or the meal. Yeah. That's something that we think would be a good thing to do. Now, whether that's something that holds a year from now, we'll have to see. But I think this experience will have people thinking, let's say 6 or 8 months from now, or whenever the time is, people will probably think back to say, I had to do this and this and this when I couldn't leave my home. And maybe that's a practice that stays with them. So okay. Maybe we see less going to the store every day and more meal planning, nutrition planning. But it's hard to say. I mean, they may want to go back to the ways that they had and that they've known for decades. So right. Either way, grocers will be prepared to accommodate their customers if they want to shop every day when that time comes, or if they need to come in for a week and load up the cart and take it home.
Okay, the takeaway from this, the Wisconsin grocery industry is healthy, is there for you, and we'll say it once more, there is no shortage of food?
There's no shortage of food. The food is safe. Buy what you need. Come in with a plan. Shop by yourself. There's no reason to hoard or stockpile. Grocery stores are going to be there for you. Grocers are there for you.
Brandon Scholz, president of the Wisconsin Grocers Association, thanks so much for taking your time. Such an important issue. Thank you.
Steve, thanks so much. It's been great to be here.
Thank you.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.